So next topic is managing ICU capacity, in particular how to increase capacity by leveraging your pre-op and PACU areas. Dr. Yohan Lonet will be
Yeah, hello.
speaking about this topic. Thank you. Yohan, it's all you.
Yeah, thank you. Hello, everyone. So I'm Yohan Lonet. I'm anesthesiologist and the clinical lead of the surgical critical care unit in Rennes Hospital in France. So we're gonna talk about how we multiply the ICU resources to face this crisis. One of the challenge is to increase the number of ICU beds as the awaited amount of critically ill patient is massive. So we defined a tackling plan, including 11 levels, which make our basic ICU beds capacity of 65 going up to 110 ICU beds. So one of the main points is to separate COVID ICU patient from non-COVID ICU patients. And so we have created two different zones to avoid any cross-contaminations between our patients. We follow, the second point is we followed a step forward strategy for COVID ICU patients. So that means we defined a single way of entrance for our COVID ICU patient, which was the medical ICU. And we defined another single entrance for non-COVID patients, again, to avoid any cross-contaminations and to answer to the need of ICU for not infected patients. Now, the key point to multiply the ICU resource and to increase the number of beds was to anticipate the deprogrammation of scheduled and non-urgent surgeries. So in this way, we were able to redirect the anesthesiologists and the paramedical staff from the operating room towards the new ICU zone. So we transformed post-anesthesia care units into a new ICUs. And then that was the main way how we increased the number of ICU beds. And so anesthesiologists and again, our healthcare providers usually in operating rooms were able to take care of these ICU patients, mainly for non-COVID ICU patients. And finally, we anticipated another an overwhelming admission of COVID patients. So we created collaboration with our surrounding private hospital, and mainly with our anesthesiologists, senior and residents who were trained in our teaching hospital and who were able to take care of ICU patients, at least for ventilation and current ICU disease. So now I can give you a quick overview on how we developed the tackling plan. So please on the next slide, yeah. So here is our basic layout of ICU organization in hospital. So mainly we've got three different critical care units: a medical one, a surgical one, and a cardiothoracic surgery critical care unit with a module of 8 beds each, multiple module. And I've represented on the right part of the slides the post-anesthesia critical care unit, with each comporting, including 12, 10, and 7 beds, and also the neurosurge ICU, including 6 beds. And we've got on the far part of the right side, the operating room who played a role in our plan. So as the crisis, at the COVID patients, the number of COVID patients increased and the admission, we've decided to create, next slides, yeah, thank you. We've got 2 different entrances, one for COVID patients who entered in the medical ICU first, and we transform each module of 8 beds into COVID ICU beds. And as the inflow of patients increased, we've progressively increase the number of COVID modules. So that means we've created created non-COVID ICU beds in the cardiothoracic critical care unit, and so we protected this zone as non-COVID patients zone. And so we were able, as the inflow of COVID patient increased, we opened progressively new module of ICU beds, COVID ICU beds. So as you see on the slides and on the animation. Specifically, we kept the non-COVID ICU beds module in surgical critical care unit because we decided to keep this patient for mainly for intermittent or continuous dialysis, which was really easier to perform. And as the crisis increased, we've opened more and more COVID units. So here is high dependency beds in the medical ICU, and then we've opened also non-COVID on the other side, non-COVID HDU beds in the orthopedic surgery PICU, and then we were able to increase the number of COVID ICU beds in the surgical critical care unit. So that was the fifth level of the plan. So up to now, we've just reached the level 5, and we didn't get higher. But we've planned, just to give you a brief overview, we can go on with how plan to develop in case of overwhelming COVID ICU admissions. So we've created more and more COVID zone, especially in the operating room, which has been transformed in COVID ICU beds, 4 beds in each rooms. And we have also planned to open post-anesthesia critical care, post-anesthesia care units into COVID ICU beds. So finally, in case of overwhelming patients, COVID patients, I mean, we've planned to open also 8 more ICU beds for non-COVID patients in private hospitals. So in the last level of the plan, we were able to free 50 non-COVID ICU beds and to take care of 72 COVID ICU beds. But as I said, we didn't reach that stage, and we just stopped at the level 5. And currently, the number of COVID admission is quite stable, and probably will go down in the next few days. I hope so. So just to sum up, the key point from my point of view are the deprogrammation of scheduled non-urgent surgery, which give us the opportunity to redirect the medical and paramedical staff into the new created ICU zone. The other thing is to separate, to have 2 different pathways for COVID patient and non-COVID patient, especially for ICUs. We move also operative room ventilators into PICU. It's another point that we could discuss later. And if we had extra time before the crisis, I can propose to have more time to prepare a triage zone for COVID and non-COVID patients, just to give time to test the patient and to decide what is the best areas, the best unit to address the patient on COVID zone or non-COVID zone. And last thing is the training of medical and paramed staff. So that's my main points, is to give more and more teaching, especially for dressing and using PPE, as Pierre Albaladejo said earlier. So that's very important to get down the pressure on the healthcare providers. So that's the last point I would say. So I finished. You can see a photo of one of our operating room on the right side of the slides, and we converted it into ICU, but we didn't use it actually. Thank you very much for your attention.